I consent to this video.
Alright, ID. Alright, so first things first, I'm going to enter the room, I'm going to have my hands washed, I'm going to introduce myself to my patient. So I'm going to say, hi, my name is Coffman, I'll be your student nurse today. I'm going to identify my patient with 2 patient identifiers. So I'm going to ask, what's your name?
Brendan Hockville.
And what's your date of birth?
9/21/99.
Alright, perfect. So I've identified my patient and myself. So the next thing I'm going to do is I'm going to review the procedure with my patient. So today we're going to be doing an assessment of your upper, lower extremities and heart sounds. So next thing I'm going to do is I'm going to apply my gloves. I'm also going to provide privacy as needed for my patient. I'm also, as I do this, going to ask my patient of 2 pertinent medical questions that have to do with the exam we're doing today. So, do you have any history of a heart murmur?
No.
And do you have any history of heart attacks?
No.
Alright, perfect. So the first thing I'm going to do is I'm going to have you stand up and please remove your shirt because we're going to take your heart sounds. Alright, so the first heart sound that we're going to listen for is the aortic heart sound. So that one would be located on the patient's right side on the second intercostal space below the clavicle on the right sternal border. So I'm going to go ahead and listen for that one first. Alright, the next heart sound I'm going to listen for is the same, just on the other side. This is the pulmonic heart sound. So I'm going to go from the clavicle down to the second intercostal space and give that a listen. Alright, perfect. So then the third heart sound is Erb's point. So that is going to also be on the patient's left side. It's going to be the third intercostal space down. So I'm going to go ahead and locate that and give that a listen. And at Erb's point, I want to note any murmurs, which I do not detect any presence of, which is obviously a good thing. So then the fourth sound that we're going to listen to is the tricuspid heart sound. So same thing, we're going on the left side, we're going down to the fourth intercostal space on the sternal border, and I'm going to go ahead and give that a listen. Alright, all seems normal, and the final heart sound that we're going to listen for is the mitral heart sound, which is located at the apex of the heart, which is on the left side once again, and we're going to go down to the fifth intercostal space, and we're going mid-clavicular line, so a little bit out, and it's usually in line with around the nipple line. Alright, perfect. So things to note with my heart sounds is I heard S1 and S2 sounds at all points. I heard my S1 sounds more clearly at the apex of the heart, and then I heard my S2 sounds more clearly at the base of the heart. The other thing I'd like to note is the rhythm was very normal. It was strong. I didn't detect any murmurs. So because the rhythm is normal, we can go ahead and take his pulse rate for just 30 seconds. If it was a regular rate, we'd go for 60, but it's normal, so we're going to go ahead and take his pulse for 30 seconds. And I'm going to do this at the apex of the heart, which is the mitral sound, because that's where I heard it the loudest. Alright, perfect. So I counted 34 beats in 30 seconds, so we'd multiply that by 2 and get a heart rate of about 68 beats per minute, which is a normal finding. So the next thing I'm going to do is I'm going to have you lay back down on the bed and just keep your shirt off for a moment for me. We lay it this way. Perfect. So the next thing that I'm going to inspect is the upper extremities. So the first thing I'm going to do is I'm going to look at both arms on both sides. They appear to be bilateral in length and width. And I actually don't report any lesions, but things I would be looking for with lesions would be like primary lesions, like any moles or freckles, or secondary lesions such as tattoos, piercings, anything of that nature. But I actually don't detect any at this time. The other thing we're going to look at is the color. Both arms are pale with pinkish undertones. I'm not noting any signs of edema or redness, swelling. Do you report any pain in your arms?
No.
So my patient seems to be comfortable. The next thing we're going to do is we're going to do the hand grasp test. So I'm going to give you 2 fingers in both hands. I'm going to have you squeeze my hands with both. All right. And I know you're good. I know good strength and bilateral strength. So he's all good there. He didn't miss my hands or anything either. He seems coordinated with his arms. So the next thing we are going to do is go ahead and move on to the legs. For the legs, I'm just going to slightly pull up your shorts. Just like the arms, I know a similar color and a palish color with pink undertones. Once again, I'm not really noting any lesions. I do see a bit of a vascular lesion there as in the form of a bruise, but nothing too major to report. The other thing I'm going to note is the hair distribution is not spotty in any way. It's very even. So then I'm going to move on and go ahead and I'm going to palpate his legs, keeping my thumb up. So what I'm going to do is I'm going to squeeze your legs going down, checking for any edema, swelling, any fluid, or moisture of the legs. So go ahead and report any pain to me if you feel any. All right. And then I'm also going to do the other leg. Perfect. So I don't notice any moisture or swelling anywhere. There's no edema, fluid free, seems very healthy. The next thing I'm going to do, sorry I forgot to tell you to do this earlier, but will you please remove your shoes and socks for this next part? Perfect. All right. So now we're going to test your flexion of your feet. So the first thing I'm going to do is I'm going to hold my hands on your dorsal side and you're going to pull your feet towards you and try to resist my pressure. All right, perfect. So dorsal flexion seems normal, bilateral, and then we'll move on to plantar. So same thing, just the other way. Perfect. All right. So flexion seems to be good, bilateral on both sides of equal strength. Then I'm going to take the temperature of the legs. So using the back of my hand, I'm going to start from the top and note the temperature of the legs. So I note on the first leg and on the second, the legs appear to be warm. They do get colder as I move down to the extremities, which is a normal finding. The other thing I'm going to do is I'm going to then check the pulse using the extremities. So the first one I'm going to use is I'm going to take your pulse with 2 hands on both sides, and I'm first going to do the posterior tibialis pulse. So that is located right under the ankle bone. All right, and the pulse seems to be bilateral, good strength, elastic, no issues there. I would grade it a 2+. The other one I'm going to do is the dorsalis, and that is between the first and second toes on both sides. And once again, I feel a regular pulse. It's strong, elastic. I would grade all 4 of those pulses a 2+. The other thing I'm going to do is I'm going to inspect the feet for any lesions or lacerations. They seem to be of good color, intact, and in good shape. I don't notice any issues there or lesions. The final thing I'm going to do is ask my patient, have you been experiencing any numbness or tingling in any of your extremities, arms and legs?
No.
Perfect. All right. So now that we're through all that, we're going to go ahead and do our closing. So I'm going to position my patient for comfort. Make sure that the call light is within reach if he needs any assistance. I'm going to lower the bed to its lowest position, raise the side rails up ×2, and I'm going to go ahead and document my findings.